Every year, thousands of young football players get concussions on the gridiron. 15-year-old Tyler Sloan, number 17, is no stranger to concussions.
Just felt like a big hit until I got in the locker room after the game. Then my head started to hurt and just felt nauseous and knew something wasn't right.
Tyler's dad, Gary, is the head football coach at the local high school. He's also president of the Minnesota Football Coaches Association. His goal in that position?
We're trying to make the game safer.
Gary's teamed up with experts at Mayo Clinic to make sure players' helmets are in good condition and fit correctly.
No helmet can eliminate the possibility of a concussion happening, but the idea of a properly fitted helmet and a good helmet is to reduce the severity of a concussion if it should happen.
Mayo Clinic athletic trainer Jim Williams demonstrates how to make sure a helmet fits the way it should.
I'm going to check the helmet for any kind of cracks, any kind of loose snaps, clips. Face mask is nice and tight.
Then measure the player's head 1 inch above the eyebrow. Next, spray the player down to simulate sweat during a game. When the helmet's on, it should be 1 inch above the eyebrow. If it's too low, pump air into the air bladders inside the helmet.
Chin straps, you want to make sure go underneath the face mask. I want to make sure that the ear holes line up with the ear. I want to make sure that the back of the head is covered.
And the pads inside the helmet should be in good shape. Replace them if they're not.
A good snug fit, but not a fit that's too tight that could cause a headache after 30 to 40 minutes out on the field.
A good fit means the helmet doesn't slide around.
You can see the skin is basically moving with the helmet, which is what we want.
2 or 3 days after the fitting, check it again. Every week thereafter, give it a once-over. Again, helmets will not stop concussions from happening.
If we can reduce them as much as possible, we feel like we're doing a better job for the kids.
For Mayo Clinic News Network, I'm Vivian Williams.